Hi everyone, welcome back to NCLEX-bay. Today we're diving into eye, ear, and throat disorders, topics that are guaranteed to show up on your NCLEX. Let's make this easy and fun. Here is our study plan for today. We'll start with eye disorders, move into ear disorders, tackle the heavyweight, the tonsillectomy, and then wrap it all up with our 5-question NCLEX challenge.
All right, let's jump right into Section 1, Eye Disorders, focusing on strabismus and conjunctivitis.
First up on our list is strabismus, which you probably know as cross-eye or squint. This happens because those extraocular muscles just aren't coordinating properly. Now, imagine you've got an adorable 2-month-old infant in your clinic and you notice a wandering eye. Honestly, that's completely normal as they develop their motor control. But, and listen closely because this is your absolute critical NCLEX cutoff, strabismus must not be present after 4 months of age. Seriously, if a 5-month-old comes in with it, that is a major red flag. If it's left untreated, it leads to amblyopia, which means permanent vision loss. So remember that 4-month mark.
Moving on to conjunctivitis, or pink eye. We've all seen it, right? Well, the NCLEX absolutely loves to test your infection control knowledge here, mainly because the bacterial and viral types spread like wildfire. The rules you need to know are super strict. 1. Perform frequent good hand washing. It's a must. 2. Absolutely no sharing towels or washcloths. 3. Kids need to stay home from school or daycare until they've been on antibiotics for a full 24 hours. And 4, make sure they discard and replace all eye makeup and contact lenses. Because if they reuse them, they're basically just buying a return ticket straight back to reinfection.
Moving right along to Section 2, Ear Disorders, specifically otitis media.
So why do little kids get middle ear infections so darn often? Well, it's literally all about their anatomy. Infants have eustachian tubes that are shorter, wider, and straighter than in adults. This structural difference actually prevents normal drainage, making it incredibly easy for a standard acute respiratory infection to travel right up into that middle ear. For otitis media interventions, you want to position the child with the affected ear down. This really helps relieve the pressure and promotes drainage. Also, tell them to avoid chewing since that just spikes their pain, and administer analgesics like acetaminophen or ibuprofen. But wait, here's a classic NCLEX trap you cannot fall for. It is absolutely critical that you teach parents to administer the entire prescribed period of antibiotics. They can never stop just because the child feels better. We have to wipe those infective organisms out completely, no exceptions.
All right, Section 3, the tonsillectomy. This is the NCLEX heavyweight, so pay close attention.
Your very first major priority here is post-op positioning. You absolutely must position the child prone or sideline. Why? To facilitate drainage. Guys, sideline is a massive NCLEX buzzword for airway protection. We want any blood or secretions naturally draining out of the mouth, not pooling in the back of the airway where it can be aspirated. And speaking of blood, you need to be hyper-vigilant for post-operative hemorrhage. The absolute most dangerous sign of bleeding? Frequent swallowing. I really want to highlight that for you. Frequent swallowing. If you see a kid doing this, it means blood is silently trickling down the back of their throat, and that is an ultimate red flag requiring immediate intervention.
We also have some really strict dietary rules post-op. If a kid asks for red fruit punch, that's a hard no. There are absolutely no red, purple, or brown liquids allowed, because if they vomit, you won't be able to tell if it's juice or an actual hemorrhage. Also, no milk, ice cream, or pudding initially. Dairy coats the throat, which makes them want to clear their throat, and that forceful action can actually pop the surgical clot. Plus, no straws, forks, or sharp objects anywhere near the back of the throat. You're going to say yes to clear, cool, non-citrus fluids instead.
Section 4, the 5-question NCLEX challenge. Now let's test your knowledge. I have 5 critical questions. I'll read the question and options, then give you exactly 5 seconds to think before the answer appears on the screen.
Question 1. The nurse prepares a teaching plan for the mother of a child diagnosed with bacterial conjunctivitis, which, if stated by the mother, indicates a need for further teaching. 1. I need to wash my hands frequently. 2. I need to clean the eye as prescribed. 3. It is okay to share towels and washcloths. 4. I need to give the eye drops as prescribed. The correct answer is 3. Bacterial conjunctivitis is highly contagious, and infection control requires not sharing towels to prevent spread. Question 2. Antibiotics are prescribed for a child with otitis media who underwent a myringotomy with insertion of tympanostomy tubes. Which statement, if made by the parents, indicates understanding of the instructions? 1. Administer the antibiotics until they are gone. 2. Administer the antibiotics if the child has a fever. 3. Administer the antibiotics until the child feels better. 4. Begin to taper the antibiotics after 3 days of a full course.
The correct answer is 1. The full prescribed period of antibiotic administration is absolutely necessary to eliminate infective organisms completely.
Question 3. The nurse is preparing to care for a child after a tonsillectomy. The nurse documents on the plan of care to place the child in which position? 1. Supine. 2. Sideline. 3. High Fowlers. 4. Trendelenburg.
The answer is 2. Sideline.
The correct answer is 2. The side-lying or prone position is crucial postoperatively to facilitate drainage and prevent aspiration of fluids.
Question 4. The nurse is caring for a child after a tonsillectomy. The nurse monitors the child, knowing that which finding indicates the child is bleeding. 1. Frequent swallowing. 2. A decreased pulse rate. 3. Complaints of discomfort. 4. An elevation in blood pressure.
The correct answer is 1. Frequent swallowing is the primary and most vital indicator that blood is trickling down the back of the child's throat. Question 5. After a tonsillectomy, a child begins to vomit bright red blood. The nurse should take which initial action? 1. Turn the child to the side. 2. Administer the prescribed antiemetic. 3. Notify the healthcare provider, HCP. 4. Maintain NPO, nothing by mouth status.
The correct answer is 1. Turning the child to the side is the immediate priority nursing action to clear the airway and prevent aspiration of blood.
Did you get 5 out of 5? Tell me your score in the comments. If you struggled with the tonsillectomy questions, save this explainer and rewatch that section. Follow NCLEX-bay for your daily dose of nursing mastery. You've got this. And before you go, I want to leave you with a quick thought. If frequent swallowing is the silent alarm for a throat bleed, what silent alarms are you missing for respiratory distress? Think about it, and we'll tackle that next time.